Hello, I'm Dr. Philippa Moore. I'm a consultant microbiologist at Gloucestershire Hospitals, and I'm the infection control doctor for Gloucestershire Health and Care NHS Foundation Trust. So I've been asked to talk to you today about getting the COVID and flu vaccine this autumn. So we know that the COVID and flu vaccines are going to be available very shortly if they're not already, and they should be available for co-administration. So why should you get your vaccine? So there are a few points here. As you probably know, last winter there was no flu around at all. So we never saw the impact of having both flu and COVID at the same time. However, there's still plenty of COVID about, and we know that during flu season, healthcare workers are exposed to flu because patients come in with it. The impact of having both flu and COVID could be particularly severe for healthcare workers. There is flu circulating around the world, and in the Southern Hemisphere, they definitely have had a flu season, albeit smaller than some seasons. However, they also have more lockdown in place in those countries than is usual. We, on the other hand, in the UK, are really reducing all of our COVID restrictions far more than some places. So we can expect the current levels of COVID to continue for quite some time, which are reasonably high levels, particularly among young people, and of course that passes through the community. And of course we will expect there to be more susceptibility to flu because we haven't seen it for basically for 2 years. So to get the two vaccines, firstly the COVID vaccine, I would like to reassure people that people who suffer side effects from the COVID vaccine do mostly from the very first dose, less so in the second dose, and we're not expecting there to be significant problems with the third dose. So that's the first thing to say. If you've had the COVID vaccine already, then you're already past the worst of any side effects you might get. If you haven't had it, I would really strongly recommend that you do. COVID is still a killer disease, and for people who are not protected, will always remain so. As restrictions reduce, so that for those who are completely susceptible, so the risk increases. The flu, as we know, is a disease that comes every winter and causes mortality among healthcare workers, among their families, as well as among patients. And we all know that it's a duty for healthcare workers to get the flu vaccine, so as not to pass on flu to particularly to vulnerable patients, but also to colleagues who will then stop them from working or in fact put their lives at risk. Some people we know with flu can be asymptomatic carriers and pass on the flu to colleagues or to patients, not suffering themselves, but causing their colleagues or patients to suffer severe disease. And so it's really important that all healthcare workers always get the flu vaccine. It's particularly important this year to get the both because, as I say, we've not seen the impact of flu and COVID co-infections, but we know that viral co-infections do happen. We know you can have COVID and RSV, for example, which we're seeing at the moment. But the two most severe respiratory viruses that are known are COVID and flu. To have the two together, and given that the disease mechanisms are different, are quite likely to result in a severe disease. But this is not yet known, but I certainly wouldn't want to risk it myself. So all I can ask is to think of yourselves, your patients, your families, and really please get both vaccines this autumn. They are, of course, free to NHS workers. I think we're in an extremely fortunate position from that point of view because they will actually be available to us, unlike a lot of the population and unlike in other countries. To waste that opportunity I think would be a huge shame for our own health economy. Any questions that anybody has about these vaccines, I'm very happy for anybody to email me, and also the infection control team will always be happy to answer questions as well. Thank you very much for listening.